Welcome back. You're watching Bonita's House Call here on SABC2. And today we motivate the hundreds of students who have chosen medicine as a career after passing matric. Now let's hear a little bit more about telemedicine, which is to a large extent was pioneered in this country by our guest here in the studio. Let's watch.
There's a great need for e-health solutions in Africa because we have a shortage of doctors. I mean, throughout the continent, doctor-patient ratios are very low. Let's just take South Africa. We have 4,200 clinics. Most of these clinics are run by nurses, so you actually have a doctor maybe visiting once a week. So we do need e-health solutions to be able to link the specialists and the doctors in the urban areas with the clinics, outlying clinics. Yes, basically you have a doctor and a nurse at two different. So in this case, we have a nurse at Kokstad referring patients to either Edendale or ourselves here, and we have X-ray scanners. Because most of the hospitals are still not digitized, you can scan an X-ray and send it to the next hospital for a specialist to give an opinion. So it really helps for diagnosis, especially it cuts unnecessary referrals.
Dr. Molefi, House Call has been on air for 10 years this year. I mean, non-stop, uninterrupted, and we thank Bonitas and many other stakeholders who have supported us through this process. Now, we get callers on a daily basis, especially from the outlying and rural areas, complaining about availability of services, especially all these sophisticated investigations. Now, you have a pilot project that you're running in KZN. How has that done in improving accessibility of specialists and other, high-flown care that patients might need wherever they are in this country?
I'll actually give you an example of a hospital in Chilidzini Hospital, which is in Venda. Dr. Obida there wants to refer a patient to Polokwane. It's like a 3-hour travel by ambulance, or if it's an emergency. All he can do is call Nancy at Polokwane and say, go and look for a certain specialist, and they can then discuss a patient. And in most cases, then that patient does not need to be referred. Give an example of neurosurgery. Mpumalanga used to send a lot of patients, so they take a CT scan, put a patient in an ambulance with a nurse. This is a head injury patient. The patient travels all the way to Pretoria Hospital. At the moment, they don't need to do that. They just scan the CT scan, then a specialist can be able to say whether that patient needs a tertiary service or not.
Can they see a patient from
yes, they can see a patient.
Because they might want, looking at an investigation or a CAT scan or whatever on its own is not sufficient. Sometimes just get to see.
But it's live consult. You can have live consultations. The specialist and the junior doctor on the other side, or the nurse, can actually communicate, and the patient can communicate with the specialist. We have sophisticated equipment. You can even listen to a patient's heart using an electronic stethoscope. So you're just sending a
from
sound
200
file.
kilometers?
It's just a sound file.
Stuff. Not expensive?
No, it's not expensive. That's the thing. I think people, when they see technology, they think everything is expensive. We've done dermatology with just a digital camera and a laptop. We gave 7 nurses the digital cameras and laptops, and they would just take a JPEG image with a clinical history, send it to UCT, and our study showed that 75% of the images were adequate for diagnosis.
No, because dermatology, you can only diagnose by looking at the skin lesion. So no amount of telephone call. Even when they call here on House Call, I always say, you know what, skin condition, we are taught you need good lighting, good ears, good eyes, and then you can see the patient.
Yes, but the most important thing is we managed to show that you can save 85% of unnecessary transfers.
Sure. Dr. Mpunja, I caused a lot of controversy last year at the Bonita's House Call Doctor's Hour.